And back now with Sunday House Call in our segment, Should I Worry? Our weekly segment in which we talk about everything that worries us. One viewer writes, I'm a 53-year-old woman, never smoked. I'm in great shape, but have been scheduled for a thallium stress test. Should I worry? Dr. Siegel, why do you think her doctor suggested this?
We don't have enough information, but I will say this, because we don't know what else she has. If she has a family history of heart disease, if she says she's not having any symptoms at all, presumably, she said no chest pain. She has high blood pressure, high cholesterol. If she exercises a lot and is about to do a marathon and wants to know if she is a risk, those are reasons to consider it. But consider this, Eric, that what's called the pre-test probability with a stress test, a thallium, which is much better.
Yeah, what is that?
Okay, what a stress test is you walk someone on or run them on a treadmill, and you look to see what happens. You simulate what's called increased workload of the heart. And when the heart is under stress, you look to see if there's an example of some narrowing that's going on. But it would have to be more than 70% of the coronary arteries being narrowed before it would come out on a stress test. 70%. Why am I saying that? Because you could have disease to your arteries of the heart and a stress test wouldn't show it. It's got to be really narrow before it comes out. It's also overdone in some people. Not everybody over 50 should have a stress test, but I told you the reasons. If she has a risk, a real risk, then I might, or diabetes is another risk factor, then I might want to do it, knowing that the pre-test probability, the chances of her having a problem is only 80 to 90% that a stress test will pick it up, not 100%. Stress tests miss the problem, and then they'll sometimes tell you have it.
So what should you do to find out if you have a narrowing of the arteries?
Well, there's other things you can do besides the stress test. We talked about calcium scoring tests to see whether you have a tendency towards it. We talk about an angiogram or a CT angiogram, a CAT scan angiogram to look for narrowing. But what I like about a stress test, one more point, what I like about a stress test is it's a test that examines function. In other words, it's practical. It's saying, hey, before you run a marathon, we're going to do it under circumstances where we can control it and see if you have the problem. So that's what I like about
David.
it.
You know, I want to play, obviously he deals with this a lot more, and there are a lot of cardiologists out there. It's good to know what is the indication for stress tests, and I want to play a little devil's advocate, just for education purposes. If you have high cholesterol or high blood pressure, should you go for a stress test? And based on what I understand, the answer is no. Like when I read this email right now, she doesn't smoke, she exercises.
She says she's in great shape.
She's in great shape. She's only 53-year-old. And if there's no chest pain, if there's no angina, there's no real family history, I don't see any reason why. First of all, we're getting this stress test. Are stress tests being overdone in this country? Are we getting too many tests? That's what I think we need to respond to that. But what happens with stress tests is when you put them on treadmill and you look at their blood pressure, you look at their EKGs. If there are abnormalities, that's when, Eric, they would go for angiogram to find out. The whole purpose of this is to find out if there are any blockage in your coronary artery disease, which is the blood flow to your heart. And if, I don't see any reason in this particular patient, but
Let me address that. What I should say is that the more risk factors you have, the more of a chance you would do this. And also if you have EKG abnormalities. Okay, if somebody's doing a screening, so in other words, a woman comes to see me, she has high cholesterol, diabetes, high blood pressure. I agree with David. I would not do a stress test.
Would you do an EKG first, then stress test? Is that the order?
And then if I see something on the EKG, then I might go for the stress test.
And what's a thallium test? Is that different than a regular
What they do is they give you this thallium, and then they take a scan and the picture of your heart, and then they start like having the treadmill. They start uploading the amount of that your heart is working, and look at your heart rate, look at your EKG changes, look at your blood pressure, and see if there is any kind of blockage. If you have blockage, you're going to have abnormalities once you go to the higher heart rate.
The thallium is the dye you put in, and it doesn't get picked up by the arteries that are blocked.
Okay.
Okay. All right, good advice as always.
Good advice.
And you know that she wrote into the doctors, and if you have a question, you can do that too. The email is housecall@foxnews.com, and they could get to a lot of the questions of our viewers who write in. We thank you for writing in, and please keep your questions coming to the doctors because they have great answers.